good to see you, Donna.
You too.
How are things?
Sore.
Okay, so the leg is still rough.
I've been doing that.
We all have the common theme within our lives of suffering, and this is what I have come to relieve. And this is the goal of my work. Did you get the lidocaine patches?
No.
She didn't get this. Are they still open? Yeah. If you can call them, just to see. I find it's a way to give myself meaning in life. This has been the focus of my pursuit of medicine and the reason why I went into medicine. Does that seem to be working well for you?
Yeah, it does.
Vince Waite will get in our mobile van and go into communities and go where the homeless are and tirelessly advocating for that population, serving that population. He devotes his life to that population.
We deal primarily with the population that has what we call dual diagnosis, drug addiction and significant mental health disease. So these are the most vulnerable people in our population. We provide them to the access to care. Yeah, you have a good day.
Working with Dr. Waite really kind of opened my eyes to realizing that being a doctor can allow you to be an agent for social change.
I think we are each called by life to develop our own meaning. Life asks us this question, and the answer lies in a life that's lived in service to others, guided by right conduct, by right action, and informed by love. So this is the thing I model, but I can only be a guide.
He's inspired me to go on and work with the homeless, and I probably wouldn't have done that if it wasn't for him.
Her lung exam, she does sound very congested. And
I think that he's made a big impact in the way I attend to patients in the room, and I think that has definitely had a lasting impact on me in the way I practice medicine.
So, shall we go and look at the patient?
yeah.
He's a remarkable resource and a wonderful teammate whose door is always open.
Can I bother you for a minute?
I've gone to him many times with medical questions because of his long history in the medical field, especially overseas in the jobs that he's had.
Ghana seemed to be the place that I needed to go, and spent 15 years there. I was involved in every aspect of the care. It was the time of my life. And I felt part of the community once I learned the language and the culture. There's a Ghanaian concept where there's no true word for thank you, because everybody has a role in the community, and this was enlightening to me. And I get the privilege to go back now with the residents from Lawrence.
They always know that they can rely on him to come, and he provides the doctors who work there full-time with a break. And he does special procedures that no one else there does, and so patients will get on a list and they wait for him to come there, which is pretty incredible.
Hi, Dan. How are things?
Pretty good.
Vince is, in his dedication, in his soul, he really exists to be there for people.
A lot of patients who don't usually feel comfortable talking to doctors, they really feel comfortable with him.
Dr. Waite is like the definition of a family doctor who's there to serve their community, and he kind of sets the example for everybody here.
He serves as an inspiration to all of us. He's as good a clinician as I've ever seen, and he's as good a man, maybe the best man I think I've ever known.
Elbow bump, and you take it easy.